2 minutes every morning can restore pain-free walking, even if you've struggled for years. The common belief that hip, knee, and lower back pain while walking is inevitable aging is not just wrong, it's dangerous. From a clinical perspective, what most people get wrong about walking pain after 60 is assuming their joints are simply worn out. This misconception leads to inactivity, which creates a vicious cycle of deterioration. However, the real problem has nothing to do with your joints. It's about three specific muscles that have literally stopped coordinating. When these muscles fail to work together, every other structure compensates, and that compensation is what generates pain. Medically speaking, this is completely reversible with a targeted 2-minute routine. You don't need pills, expensive orthotics, or hours of therapy. Today, I will show you the exact 3 movements that restore the natural walking pattern your body was designed to perform. These are scientifically proven exercises that directly address the muscular dysfunction causing your pain. We will cover the movement that releases the primary source of hip and lower back pain, the activation that eliminates knee pain by restoring proper muscle firing, and the stabilization technique that protects your spine with every step. More than that, I will show you precisely why each movement works and what physical changes you should expect within the first week. Let's begin with understanding what's actually happening in your body. Your body is engineered for walking. It's the most fundamental human movement. But walking requires precise coordination between your hip flexors, your glutes, and your core stabilizers. These 3 systems function as an integrated unit. When they're working properly, walking is effortless and completely pain-free. Here's what happens with age and inactivity. Your hip flexors, the muscles at the front of your hips that lift your leg forward with each step, become chronically tight. This tightness creates a mechanical problem. Those shortened hip flexors pull your pelvis into an anterior tilt, which immediately throws your entire kinetic chain out of alignment. When your pelvis tilts forward, your glutes stop firing properly. They become inhibited, a phenomenon called reciprocal inhibition. Without your glutes doing their job, your lower back and knees absorb forces they were never designed to handle. This is when pain begins. Hip pain, knee pain, lower back pain. And you accept it as arthritis or inevitable decline. Medically speaking, this is a coordination problem, not a structural problem. And coordination problems are fixable. This 2-minute routine does 3 things with surgical precision. It releases those tight hip flexors, it reactivates your inhibited glutes, and it engages your core stabilizers so everything moves in proper sequence again. Simple, effective, evidence-based. Movement 1, the hip flexor release. This addresses the root cause of most walking pain, those chronically shortened hip flexors. Find a wall or sturdy counter for light support. Stand approximately 2 feet away and place both hands against it. Step your right foot back about 3 feet. Your left foot remains planted forward. Both feet should point straight ahead. Here's the critical element. Gently press your hips forward toward the wall. You're not bending or leaning. You're creating anterior pelvic movement. You should feel a deep pulling sensation at the front of your right hip. That's the hip flexor lengthening under controlled tension. Hold this position for 20 seconds. Breathe normally. Do not bounce. Just hold and allow the tissue to release. Switch sides. Left foot back, right foot forward. Press your hips forward. Hold for 20 seconds. That's 40 seconds total. What you've just done is release the tension that's been pulling your pelvis out of alignment for months or years. You've created space in the hip joint, and space means reduced compression, which directly translates to less pain when you walk. The effect is immediate. That pulling sensation in your hip eases. Your lower back decompresses. This single movement is often the difference between painful and pain-free walking. Movement 2, the glute activation squeeze. Now that we've released the front of your hips, we must reactivate the back. Your glutes are the powerhouse muscles that propel you forward when you walk. But for most people over 60, these muscles have become neurologically inhibited. They've been compensating for so long using their lower back and quadriceps that the glutes simply stopped firing. We're going to reverse that right now. Stand with your feet hip-width apart. You can hold a counter or chair for balance if needed. Now maximally contract your glutes, both sides simultaneously. as hard as you possibly can. This is not a gentle squeeze. This is a maximum voluntary contraction. Hold that contraction for 10 seconds. Focus on feeling those muscles engage. Then relax for 5 seconds. Contract again for 10 seconds. Relax for 5 seconds. One final time. Contract for 10 seconds. Relax. That's 40 seconds of targeted work. What you've just accomplished is neural reactivation. You've sent a signal to your central nervous system, reminding it that these muscles exist and have a critical function to perform. When your glutes fire properly, they take loading stress off your knees. They stabilize your pelvis. They reduce compensatory strain on your lower back. This is why knee pain often disappears within days of performing this simple activation every morning. The knees weren't the problem. They were the victim of glute dysfunction. Movement 3, the standing core brace. The final component, your core stabilizers. This isn't about aesthetics. This is about creating midline stability so your hips and legs can move freely without your spine absorbing shock with every step. Stand tall with feet hip-width apart. Place your hands on your lower abdomen just below your navel. Take a deep breath in through your nose. As you exhale through your mouth, gently draw your belly button toward your spine. You're not sucking in. You're not holding your breath. You're creating intra-abdominal pressure and engaging your deep core muscles. Hold this gentle tension for 10 seconds while breathing normally. It's a subtle engagement, like bracing for a light tap to your stomach. Relax for 5 seconds. Engage again for 10 seconds. Relax for 5 seconds. Final time. Engage for 10 seconds. Relax. That's 40 seconds. You've just activated the transverse abdominis and deep spinal stabilizers that protect your lumbar spine and pelvis during gait. When these muscles function properly, every step feels lighter. Your balance improves, your posture corrects, and that chronic lower back pain begins to diminish. That's the entire routine. Hip flexor release, 40 seconds. Glute activation, 40 seconds. Core brace, 40 seconds. 2 minutes total. That's all it takes to restore proper walking mechanics. Here's what you need to understand about consistency. Your body has spent years developing these tight structures and compensatory patterns. You're not reversing all of that in one session. But if you perform this routine every single morning for just 2 minutes, within 1 week, you'll notice measurable improvement. Within 2 weeks, walking will feel easier than it has in years. Within a month, the pain you've been accepting as normal may be entirely gone. This isn't theory. This is clinical reality based on proper biomechanics. Do this at the same time every day. Habits form through environmental cues. Attach this routine to an existing behavior right after you brush your teeth, while your coffee brews, before you check your phone in the morning. Consistency is everything. Don't stop when you feel better. That's when most people fail. They improve and assume they don't need it anymore. But this routine isn't just therapeutic, it's preventive. It maintains healthy movement patterns so you can keep walking pain-free for the next 10, 20, 30 years. Listen to your body. These movements should feel productive. You'll feel stretching. You'll feel muscles engaging. But you should never feel sharp pain. If something hurts, reduce the intensity. You can always progress as you get stronger. Be patient with yourself. Progress isn't linear. Some days you'll feel remarkable afterward. Other days you might not notice much difference. That's normal. What matters is showing up consistently. 2 minutes a day. Every single day. What about arthritis? This is critical to address. What if you have diagnosed arthritis? What if your doctor has told you your joints are degenerating? The answer is this routine can still dramatically reduce your pain. You're not reversing arthritis, but improving the way your muscles function takes mechanical stress off damaged joints. Less stress equals less pain. It's basic biomechanics. I have worked with patients who were candidates for joint replacement. After performing this routine consistently for several months, they postponed surgery because their pain became manageable. Some never required the surgery at all. This isn't a cure for arthritis, but it absolutely can make living with it dramatically more comfortable. What you'll notice: your stride will lengthen. Right now, you're likely taking short protective steps because longer strides hurt. But as your hips open and your glutes reactivate, you'll naturally start taking longer, more efficient steps. Your posture will improve. You'll stand taller. Your shoulders will retract. Your head will align over your spine instead of protruding forward. Better posture means less strain on every structure. Your energy will increase. Walking won't feel like such an effort anymore. You'll have the confidence to walk farther, to explore more, to say yes to activities you've been avoiding. Most importantly, your independence will be protected. Walking is freedom. It's autonomy. It's the ability to go where you want without relying on anyone else. This 2-minute routine preserves that freedom. Tomorrow morning, begin. Stand in your kitchen or bathroom. Perform the hip flexor release. Perform the glute activation. Perform the core brace. 2 minutes, that's all. Do it again the next day. And the day after that, for 7 consecutive days. Just 1 week, and you'll feel measurable improvement. You'll move more easily, you'll walk more smoothly, and that pain that's been limiting you for months or years will start to fade. The best time to start was years ago. The second best time is right now. Claude can make mistakes. Please double-check responses.